Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Scharfman, a board-certified holistic nutritionist living in Los Angeles, and with me is Dr. Andrea Moskowitz.
Hi, I'm Dr. Andrea Moskowitz, and I'm a neuroscientist and psychiatrist. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. So
Good.
I'm sure there are things that keep you up at night, and there are things that keep me up at night. Lots of different things, but one of them is my bone health.
Okay.
Because I have already gone for my scan, and my bone mass density was not as high as I would have liked it to be. And I'm concerned.
All right.
And I want to do what I can to make sure that
of course
those bones stay healthy, because I know 55% of postmenopausal women do develop osteoporosis. Right. 25% of all men. And statistically, within 12 months of a hip fracture, 20% of those people will die. And
that's a lot.
That's a lot. I also know that, like, my grandmothers all had this thing called widow's hump.
Right.
Which is,
that stoop.
Yeah, that little stoop. It comes from tiny breaks in the vertebrae that never really heal properly. Right. But I one of my goals is just to avoid the widow's hump. So
also, you get shorter.
You do get shorter.
From osteoporosis.
Yeah.
Because it's a compression.
Yeah. Now, I'm 5'9", so a little shorter. Okay.
Yeah, well, speak for yourself.
But
I'm 5'5", and I don't intend to start wearing 4-inch heels. So
okay. So let's talk a little bit about bones and what they're made of and
why they're so important.
And why they're so important.
Okay. So I'm glad you asked.
Okay.
So let me talk about why bones are important. So, a lot of times I think people walk around and they think of bones. Oh, I should back up. We recently did some remodeling. So when we were remodeling, we opened up the wall and we saw our beautiful wall studs, which are actually very nice looking. And that's how a lot of people think of their bone. They think of it as like the studs in a wall. Those are like those vertical wood frames holding the rest of everything up. And they are kind of like that, but they are so much more, because they're actually, in some ways, they're an organ. They're live tissue that's constantly renewing itself and constantly supplying us with things that we need.
Right. So I remember as a kid, like, kids would get growing pains. Right. And everybody would be like, oh, growing pains. And they thought they were this phantom thing. But the truth is, because your bones are living tissue and they're constantly being built up and broken down, that pain that kids were feeling was real. It wasn't something that they were making up.
Right. So let me go through. So bones, obviously, they support us.
Right.
They allow us to move. Right. Because we couldn't move without them.
Right.
They protect our vital organs. If you think about it, there's bone around our brains, right? Around our brain skull. Yeah. Around our heart, around our lungs, and even around our kidneys. There's the back of the kidneys are nestled up under your ribs in the back. And they also provide a storehouse of minerals, such as calcium and phosphorus, which are used to make up bone. But they're also used for a lot of other things in our body, like almost everything, including muscle movement. And they also provide a store that we can use, like when we need it. So, for example, when we're pregnant or when we're breastfeeding and when we need more calcium for milk production. And then the good part is, by the way, that although that does deplete it a little bit, it all gets put back.
Right.
So, and in fact, there are some studies that pregnancies may actually help increase bone density, probably because it stimulates your bone to break down a little bit, but then also put itself back together again a little bit. The other thing that bone does is people don't think about it. So, I don't know how many people do this. Sometimes you go to the butcher and you get bones, right, to make like a really hearty soup. So if you ever look inside the bone, what's inside of it, Jill?
Marrow.
You know that as a nutrition, right? Marrow, right?
I know that it's a cook
too. And actually, marrow can be a delicacy. Sometimes people, take it out, and they spread it, and it can be very tasty. But it's not just a taste treat. The marrow is in there, and it provides all our blood cells. So, if somebody ever has a problem with blood cell production or whatever, they do a bone marrow biopsy.
Right.
Or somebody donates bone marrow to help somebody. So those are the cells that make up all the blood cells that fight off infection, that provide ways to transport oxygen around, the red blood cells, provide us with our energy. So bone is incredibly important, and it's vital, and it's living.
Right.
So the outer part of it is harder, obviously, and it's a mineral crystal made of calcium and phosphorus, and it gives it its hardness and strength. And the inside of most bones, not every bone, is spongy, and it contains it's all a little spongy, contains cells that form and break down bone.
Right. So those are osteoclasts.
Right, and osteoblasts.
Okay, so osteoclasts break down removal bone tissue, and that's slowed by estrogen, right?
Yeah.
Yeah, and then new bones are laid down by the osteoblasts, which are stimulated by progesterone, testosterone, and exercise.
Right.
And this is important to know because we're going to talk a little bit later about hormones and why it's important for bone health.
Right.
Okay.
So the problem becomes, as we get older, the bone is all the time being broken down and made, broken down and made, broken down and made. Just like actually most of the cells in our body, to be honest. But the older we get, it slows down.
Right. So it slows somewhere between 30 and 40 years old.
Right. It starts.
Right. And, ideally, I was just listening to a lecture. They said we should start testing at 35 to determine peak bone mass. Not that insurance is going to pay for that, but that would give you an idea of what your peak bone mass is, because really you don't know your bones are in trouble until, God forbid, you break one.
Right. Or you have the test done.
Right.
So, so let me explain what the test is, just quick, so people know. So it's not like some hocus pocus magical thing. So what they're actually measuring is they're measuring the density of the minerals in your bone. So it's measuring how much of that calcium phosphorus crystal you have in your bone.
Okay.
And that's an indication of how strong your bone is. Okay.
Is it how strong the bone is?
Yeah, because that's the outside. It's an indication. You're actually testing the matrix, the calcium, but that forms the hard part of the bone.
Okay.
So it's not maybe the only indication, but it's the easiest one to measure.
Okay.
So the mineral content is measured with a DXA or DEXA, some people. So just for completeness' sake, so you've heard it one time, it stands for dual energy X-ray absorptiometry test.
Good word.
That was a hard one. And it is a little bit of radiation, but it's not really that much.
And it's really, when they do the X-ray, it's really looking just at your hips and your spine. It's not really a full body scan.
Actually, sometimes it's not a full body scan. A more complete one, you're right. So it's the lower spine. Mm-hmm. It's the hip, but it's the upper thigh bone next to the hip joint.
Okay.
And a lot of times they'll look at the forearm. And the reason these parts are chosen, can you guess why?
Is there the strongest?
No, if you fall.
Yeah,
those are the three areas most likely to break.
Yes, got it. That makes sense.
Or from stress. Or from right.
Got it. Okay.
So, I mean, other things can obviously break.
Right.
But those are the highest percentages of breaks.
Okay.
Right?
Got it.
And especially that forearm. That's
the wrist.
The the wrist actually, but just above the wrist.
Okay. Yeah. So when they say they broke a wrist, it's really the forearm, you think?
Yeah. Usually because the wrist is a joint.
Okay.
So people kind of go around, they say, I broke my hip, I broke my wrist. They really broke the bone that comes into it.
Got it.
Yeah, that's part of the joint.
Okay.
Okay. I know that sounds like very picky, but not exactly. Not if you're fixing it.
Okay.
So they give you the results. It's called a T-score.
Mm-hmm.
So a T-score, I'm not going to get too much into statistics, right? But it's how much your score differs from the bone mineral density of an average healthy 30-year-old of the same sex as you.
Okay.
So,
do they look at race there at all? Because I know there are differences in race.
Yeah.
I think they
might.
Yeah,
they do. Okay.
So there's high, normal.
Right. So a T-score of so it's negative T-scores, right? Because you're losing density. Mm-hmm. So a T-score of -1 to -2.5 is classified as what's called osteopenia. Okay. And there's osteopenia and there's osteoporosis. And you just can think of osteopenia as sort of on your way to osteoporosis.
So it's weakened bones with an increased risk for fracture.
And somewhat, but not as much as with osteoporosis.
Osteoporosis is more porous bones, low bone mass, and a higher risk for fracture.
Right. So the T-score of -1 to -2.5 is classified as osteopenia. And the T-score below -2.5 is classified as osteoporosis. Now, it's very important to state, again, this is referenced to a 30-year-old. Mm-hmm. So that's why you can get large percentages of people over a certain age having osteopenia or osteoporosis.
Right. So in that same lecture, he pointed out something very interesting. Somebody who might be 60 years old and has low bone mass density, it's not necessarily that they had high BMD when they were 30 and that they just took this roller coaster ride down.
Don't know.
Right. They could have had poor bone mass density to begin with.
Right.
And this is where they ended up.
Although the truth is, the way the statistics works, that can't be true for everybody.
Right.
Because since so like the average 30-year-old, right, is the average 30-year-old. So they're not in that -1, that minus category at all.
Right. It's an average.
It's an average, right.
Okay. So
and then some of the risks of osteoporosis, as we talked about, are the increased bone fractures, which can lead to disability and increased risk of death. Mm-hmm. And there's a lot of complications that happen, as you mentioned, with hip fractures.
Right.
Because then it leads to you not moving around. You have to have surgery. Mm-hmm. You can get a pneumonia, you can get a urinary tract infection. There's just a lot of...
Right. Can we talk about what some of the risk factors are to getting it to begin with?
So I want to start with things you can't change, and things you can change.
Okay.
Because the things you can't change, you can't change.
Right.
So, sorry, ladies, it's a higher risk if you're female. That's it. And that's because we just don't have as much testosterone. And we don't have as much muscle mass.
Right.
So we don't just build as much bone as guys. I know, not fair. Older age, the older you are, because you're not building as fast as you used to. Smaller body frame.
Yeah.
Probably because there's less, I'm not saying you should be very overweight, but if you're really slim or if you've had an eating disorder, right? One of the reasons for bone being made is stress on bone.
Right.
So, or having to do more.
So there's less impact on your bones, so you've
had to move around, less weight, so your bones are lighter. Mm-hmm. Also too, some people just have a very light frame.
Right.
So and you're right, probably when they were 30, they also had a lower bone density because they had just smaller bones.
Well, I know specifically they talk about Asian women
and Caucasian women.
Yeah.
So African American and Latina women have less of a risk, although they can get it too.
Right. Yeah. It's just less of a risk.
And then a family history of osteoporosis.
Right. Of
course. Okay. So, and it's also increased risk with a whole bunch of different problems. Some of it is because of the problem itself. Some of it's because of the medications that have to be used to treat it.
Right. So we'll get into that in a minute. So
let me go to things you
other
can
risks.
Change.
Right.
Okay. Well, that is some of the other risks.
Right.
Yeah. Right.
There's a lot
let me go into things that you can change.
Okay.
So things you can change. Low calcium intake. Inadequate calcium intake.
Right.
Which doesn't mean milk products, but there's other ways to get calcium, and you'll go into that.
Yes. But also there are people who have a problem with absorbing calcium.
Right.
So that has to be treated as well. And even people like, I think you were mentioning, people who take calcium carbonate, which is Tums.
Right.
Doesn't break. Well, just in terms of
it's not well absorbed. For
it's calcium. Not well absorbed for calcium, and they think they're doing well. So your body chemistry, how you assimilate your nutrition, has an effect on the calcium that you take in.
Right. Sedentary lifestyle. So again, putting more quote unquote like more pressure on your bone, using it more. Mm-hmm. Those saying use it or lose it.
Right.
That it definitely applies. Smoking. If anyone's smoking, there are so many reasons why you should stop smoking, but this is another reason. And excessive alcohol consumption. So I'm not talking about 1 or 2 glasses of wine a week. I'm talking about, daily alcohol consumption.
Right.
It's not a good thing for bone density in general.
Right. Also, NSAIDs and COX-2, things like Celebrex that treat arthritis inhibit bone repair. So, that we don't want to overdo that. And
those are all discussions with your treating physician.
Yeah.
Because a lot of times, as somebody who's had a kidney transplant, they will be on for their lifetime a small dose of prednisone, which is a steroid, and they will have bone loss. But it's not don't go off your prednisone.
Right. But for the majority of the population, that it's good to just know those medications and what to stay away from, and so
or what to treat with care.
Right. Okay. So now, allopathic medicine, generally, they will prescribe things like Fosamax or Boniva.
Right.
Those are the most common drugs. But there are issues with that. You have osteonecrosis, which is jaw death, where your teeth could fall out.
Right. Although it's not so common.
Okay.
So I will say that. It's a very, that's the thing with a lot of medications. There are side effects that can be very scary.
Right.
Oftentimes they're also not very common.
Right. So I think what I've seen the biggest problem with Fosamax is that it chemically, it looks like it's building the bone matrix.
Right.
But in fact, it's really suppressing your own body's doing any remodeling. So when they look at the scans and they see that the scans look denser, it's really just that chemical building up.
Well, actually, though, the long-term studies also not to, but they do reduce the risk of fractures.
They
so
do.
They're not just looking. Yeah, because you know what? The truth is also, too, in some ways, so your bone's a little bit thicker. So what does that mean?
Right.
Sometimes medications, they have an effect, but is it clinically significant?
Right.
Is it practically significant for your life? So what if your bone's a little thicker? How is that going to help you?
Exactly.
So what they have done now long term for all of them is to look at the risk of fractures. Because that really, at the end of the day,
is what they're trying to fix.
Is what they're trying to prevent. So it does decrease the risk of fractures.
Right. Okay.
And again, the truth is too, though, putting it aside, these are not easy medications to take, cause a lot of stomach upset. You have to take it on an empty stomach.
Yeah.
There's just a lot of factors with them, and you have to be consistent with taking them.
Yeah.
So
there's
other things you can do from your point of view, because I would say they can be useful for people, but they're not the only thing.
Right. So the first thing I would say is that you want to treat it like any underlying health condition. It's not necessarily a disease. It's rather a symptom of poor health, poor nutrition, lack of exercise, your hormones out of balance,
aging,
your stress, your lifestyle, aging. So you want to restore normal function.
Right.
And you want to stimulate the body's ability to heal itself rather than just treating the symptoms by taking, some of these medications. So what do? We have an acronym called DRESS: diet, rest, exercise, stress reduction, and supplements. So that's for everything, really. If you treat your body well, this will just be an outcome anyway. So some of the dietary suggestions and supplementation to build bone and heal it. We want a diet rich in calcium. So those are things like salmon, sardines with bones, leafy vegetables, and vitamin D. You can get vitamin D through supplementation, or you can get vitamin D through sun exposure.
Right.
You don't get vitamin D through sun exposure. You sit in the sun and your body produces vitamin D from the sun exposure. Weight-bearing exercise, healthy lifestyle, no smoking or excessive alcohol. Want to get your hormones checked because, like we said, hormones are very important for the breaking down and the building up of bones. Exercise, because exercise causes our body to pick up calcium from our bloodstream and deposit it into the bones. And weight bearing is what's important here, because swimming is a great exercise.
It's a great exercise, but it's not weight bearing.
It's not going to do that. You want to keep your stress levels down, because if you have additional cortisol in your body, it causes your blood to be more acidic, which will take calcium from your bones. So you want to eat alkalinizing foods like vegetables, nuts, seeds, sea vegetables, essential fatty acids.
Right.
Let's see what else. So,
and then also too, if you're more stressed, as you said, you have more cortisol. Well, cortisol is one of those steroid hormones that decreases bone
Yes,
density
exactly.
by itself.
Yeah. There are botanicals you can take, things like horsetail. I think probably in that situation, either talk to a nutrition professional and see what they recommend. Vitamin D3, vitamin K1 and K2, which has phosphorus to help mineralize the bones. Vitamin A for bone growth. Vitamin C and protein, which will stimulate the collagen. Healthy fats to absorb your fat-soluble vitamins.
Right.
Magnesium, you need to take in relationship to calcium because it helps with the absorption from the blood to the bone. There's something called boron, which decreases the amount of calcium, magnesium lost in urine. And strontium, which I do take every day, which helps remineralize the bone, which is in herbs and seaweed. But probably my best suggestion is if you're going to go the supplement route, there are bone health supplements that will put all of this together for you.
And I would also say, though, if you're on other medication, remember before you take any supplement, run it by your physician. So, for example, vitamin K is great. Not so much if you're on a blood thinner.
Right.
It's going to be a huge problem.
Okay. Right. So talk to your doctor.
And the same actually for if you're doing some major dietary changes, because the same thing would hold for the same reason for a lot of dark leafy green vegetables. If you're on blood thinners, you can't do that.
Right.
Because they have a lot of vitamin K in them.
Okay. Right. So you have to be careful. So,
or you have to be closely monitored while you're doing it.
Yeah. So diet and exercise.
Right.
Check your hormones.
Yep.
And supplement where you can and where necessary.
Right.
All right. Well, thanks, Andrea. That was
Thank you,
hopefully
Jill.
I'll sleep better now tonight.
I hope so.
Now
Me
that
too.
I have all this information.
Right.
Okay. Don't forget to follow me on Instagram at Jill Scharfman. And thanks.
Thank you, Jill.
And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004. Post on Instagram, Twitter, or Facebook with the hashtag #LetMyPeopleEatPodcast. If you like this show, please make sure to leave us a 5-star rating and review on iTunes. Tell your friends and family, and subscribe to us on Apple Podcasts.
And please remember that although we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own health practitioner about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I'm Andrea Moskowitz.
Thanks for joining us.
And go in good health.